I'm Dr. Gaby Berger. I'm a general internal medicine physician at the University of Washington. And I would say I've had a few different phases to my career. I started out as a hospitalist at the main university hospital here at UW. And in that role, I also had a footprint in sort of QI and patient safety work, and then moved over to our primary care space about 7 years ago, and now consider myself a full-time primary care doctor, but also wear an education hat with a role in our University of Washington School of Medicine, where I co-direct a longitudinal teaching and coaching program for our students. When I think about the biggest shifts in primary care today, I think about a number of trends. Number one is just the incredible time crunch that primary care physicians are in. We have very little time to see our patients typically because of billing requirements. And so the visits get very compressed. And we have to do a lot in a small amount of time. So time compression, I would say, is one huge trend that folks feel across the country. The other one is certainly the advent of the inbox. So my institution uses Epic. Many folks use Epic. There are many other electronic medical records out there. All of them have secure online messaging for patients. This has fundamentally changed the way that we practice primary care. And then I would say, there's been a huge growth of online telemedicine services that exist both within a health system and outside of health systems. So people can access primary care online almost entirely now. Doesn't always necessarily provide the same continuity of care that we typically think of in primary care. And that has also fundamentally changed, I think, the way that people access primary care services, and has changed the relationship with primary care as there is fewer and fewer true longitudinal relationships that I think get built over time. I think this is a hard time for primary care physicians, to be honest. I don't know when the last time it was that someone would say it was an easy time for PCPs, but I think that the electronic medical record and the online patient portal has introduced a level of complexity and expectation from patients that is honestly really hard for all of us to keep up with. I think we all entered this profession, and particularly this field, because we care about holistic care for our patients. We care about relations. We care about longitudinality. If not, we would have done something else, right? And all of that has been in some ways compromised by the incessant online messaging that happens, primarily because it creates an expectation of how quickly we can respond to patients and with what level of detail. It detracts from being able to see patients in person or even through telemedicine, right? The online inbox is, I'm differentiating that from telemedicine visits, which I think have been hugely helpful in creating more access for our patients. But the idea that we have to respond to all of these messages throughout the day when we have a busy clinic day, and then if we don't have time to respond to the messages, we have to do that at home, late at night, built around our family. Many of us we're just humans, right? We all have, not we all, but many of us have kids, other home responsibilities. And so trying to fit that extra work in has been, I think, challenging for everyone across the country. Technology has been huge in the way that we engage with patients today, and I think that will continue to change over time. So I have lots of thoughts on this. Certainly one is around inbox management for online messaging. In a lot of ways, I love it, right? I love that I can just refill something for a patient quickly or answer a quick question. As a primary care doc in academic medicine, half of my time I spend teaching in the medical school, so I'm only in clinic half the time, and part of that I'm supervising our residents. So my own clinic time is limited. So I really value that I can provide some meaningful care for patients through messaging when appropriate. So I will say there are benefits there for sure. Telemedicine, which really grew dramatically, obviously, during the pandemic, has been fabulous for patients and for providers alike. So there are times when, I may have needed to cancel a half day of clinic because of a family emergency. A kid is sick at home, but actually I can do telemedicine visits from my home with my patient if they're amenable to that, and avoid canceling a clinic session, which is huge. And I think is, a win-win both for me and for the patient. And for patients who may live far away, have difficulty with transportation, who really aren't feeling well, can't get into the clinic that day, or who are really may have a upper respiratory infection, they're concerned that they could be infectious to others. It's great that sometimes we can do really effective medicine and really effective counseling through telemedicine. So telemedicine has been huge, and I really, really hope that our lawmakers will continue to support the use of telemedicine in primary care. Another thought that I have around the benefit of technology, and sometimes this is a little bit challenging as well, is all the new personal devices that patients use and bring into clinics. So Apple Watches, where they track their heart rate and O2 sats, or other, their Aura Ring, where they're tracking their sleep patterns. I would say this is really empowering for patients, and sometimes it can give me really useful data. Sometimes it can be really hard to help patients step back and not overly fixate on things that aren't clinically relevant. So there's definitely a balance there. But technology also helps us monitor folks remotely, right? So they can drop into the lab, get labs. I see those labs. I can communicate with them through MyChart, which is our online portal system, and manage things without necessarily bringing somebody back in for a visit if it's not needed. So that's hugely helpful. And then things like CGMs, right? So continuous glucose monitors, which allow and empower patients really to manage their glucose levels throughout the day. That information transmits to their smartphone, which then can be uploaded into our electronic medical record. I can review that and make decisions about their diabetes care. That technology has been really revolutionary. The other huge innovation with technology that we have to talk about is AI. So AI is now powering lots of different sort of note-taking apps within the various medical records. And this is truly going to be transformative. I really believe this. I think there's a lot of fear that AI may take over primary care. I still really believe that a human brain is important in thinking about how to build relationships and deliver meaningful longitudinal care. But the AI note-taking tools are powerful, and I'm piloting one in my clinic now. I wouldn't say it's perfect. I have a lot of feedback for them, but the reality is it makes my notes quicker. I leave clinic sooner. I have fewer notes to finish up at home at the end of the day. And this is extremely powerful and super important for my own sense of well-being and balance when I think about how to navigate a primary care career and family. Be open to the pendulum shifts in medicine. 20 years ago, we thought prescribing hormone replacement therapy for people going through menopause was a terrible idea, that it was going to cause everybody cardiovascular disease and, venous thromboembolism events. And now, of course, we understand with much more nuance the benefit of hormone replacement therapy for folks who are going through perimenopause and menopause. And I think we really undertreated and discounted this incredibly important medical experience for half the population, right? And we really have an opportunity to treat symptoms for people in menopause in a meaningful way. I bring that up just as an example of the pendulum shifts in medicine, right? Hormone replacement therapy is actually not new at all. It's just we're using it again because we better understand the data. And so be open to those changes because medicine will always surprise you.